Hey, what's up, everybody? Thank you guys for joining the Men's Health Community Connections podcast. It's presented to you by Advocate Aurora Health.
I'm your host, Chad Cino Roper, and I'm here with my co-host, Mario J. Brown. Health issues continue to plague our communities, especially the communities of color. There are consistent data on the health disparities in impacted groups such as men of color. Today, we're going to shine just a little light on it. You know what I'm saying?
Yes, sir. Let's speak on it. So check it out. My co-host and I, as Black male leaders, we're just taking a chance, and we're going to make sure that people understand and take responsibility of helping educate our own community on men's health using the platforms that we've both built for over 25 years in the music industry.
And we recognize our platforms of influence and have partnered with Advocate Aurora healthcare professionals to bring education and inspiration specifically to our communities of color.
Yes, sir. So joining us today, we have a very special guest, none other than Dr. Okubanjo. Dr. Okubanjo, thank you for joining us. Let me pull you up on screen. Hey, how are you?
I am great. Thank you all so much for having me. I love doing things like this because it's so important. So thank you.
Absolutely,
Yeah,
our
no
pleasure.
problem. Our pleasure. So tell Dr. O, I'm gonna call you Dr. O because I'm gonna mention your name if I keep saying it over and over again. So I don't want you to hate me. So Dr. O,
Okay.
talk to us about where you from and how you grew up.
Yeah, so I'm from the South Side of Chicago. Actually, I was born in Nigeria, and then we moved here when I was about 7 years old, and we moved straight to the South Side. And when I'm saying South Side, I don't mean like, oh, I'm a little bit on 50th. No, I grew up on like 73rd and South Shore Drive. Like I
In there.
went to in there, right? But when I grew up, I was like a Park District kid, right? Parents were immigrants. My dad drove a cab. My mom worked all types of whatever work they could do to, to feed us and take care of us. So we were raised by our local schools in the Park District, proud product of CPS. I went to grade school at Adam Clayton Powell. I went to I did like 7th and 8th grade at Kenwood. Then I went to Whitney Young for high school. Stayed pretty local the entire time. I was very lucky that when I was in high school, as a high school senior at like 17, my mom was like, "We're having another baby." So I have a much younger sister. So it kind of kept me local. So I went to UIC for medical school. Ultimately chose to go into emergency medicine, which is what I do now. I mostly work at Advocate Christ in the ER. I also work at Trinity sometimes in their ER just to be more connected with the hospital that raised me. Areas of things that I do. I did my fellowship at Cook County, and then went back to be full time as a teaching attendant at Christ. So I've been mainly in that space, space of diversity, equity, inclusion, space of increasing opportunities for people that look like me because somebody helped me get here. So I'm going to do my best
Yeah,
to help others that look like me get to where they need to be. And I'm very passionate about all things Black. Sometimes I have to remind myself that there's other things out there, but I am very passionate about all things Black.
for sure, for
There you go.
sure, for
That's
sure.
what's up.
Wow. South
That's
side.
the sight,
All
the
Okay.
day,
South.
all day, okay? All day, right?
Man, salute for getting it out the mud, for coming from the bottom and getting to where you are. We gotta give you a salute for that. But yeah, so we got some questions we want to dive right in, and some of these questions
But
are really
before we
really
jump
good.
in, before we jump in, you said you were born in Africa. What part of Africa?
Mm.
Nigeria.
Nigeria. So
Hmm.
when growing up from Africa, what was the transition like? Because I've never been to Nigeria, but I've been to Ghana and I've been to uh, what Nelson Mandela. I can't. It's slipping my
South
mind.
Africa.
So, yeah. What I can't think of the name. It's not Cape Town. It's Johannesburg. There it is,
Okay,
Johannesburg.
yeah.
Yeah. So what's the difference coming from, let's say, Nigeria to the United States? Like what was
I would
the
say,
culture?
I was super young when I came here, but my parents
Hmm.
were always very much like, you got to go back. So we used to go every summer. And one of the biggest differences I noticed is that healthcare in Nigeria is completely different, right?
Hmm.
So, like, healthcare in Nigeria is kind of you pay for whatever services you can afford. And if you can't afford it, you don't get it. Versus here is like there's this whole concept of insurance, which is low key a scam, but there's this whole concept of insurance, and with insurance, they're the underinsured. So what I found is that even though health is more accessible here,
Hmm.
in Nigeria, as long as you can pay for it, everybody gets the same health. That being said, you got to be able to pay for it. Other big differences is Nigeria is hot. Like once you leave Nigeria for a long time, you start to sweat, and everybody knows that you're not like a real Nigerian anymore because real Nigerians don't sweat. Like they're just completely fine. And I'm getting there, and I'm like drenched in sweat. I look terrible. They're like, "Yeah, you got to go back." So yeah.
Go ahead and start us off with the questions, Mario. Thank you
Okay,
for that,
cool,
Dr.
cool,
O.
cool. So you're an ER doctor, correct?
Hmm. Yes,
So
sir.
that's where we definitely want to just spend some time focusing there. So basically, what constitutes an emergency? What are some reasons why someone would need to go to the emergency to begin with?
Yeah. Absolutely. So I would like to say anything and everything can constitute an emergency because oftentimes people play down their symptoms. And by the time they show up, we're like, man, why didn't you come 2 days ago? Or why didn't you come when the symptoms first started? As much as people might feel like, hey, it's just a little cold. Hey, I'm just a little tired. Hey, it's just a little something like this. You never know what it might mean. And oftentimes, by the time I'm seeing people, is when they have to come, right? And nobody
Mm,
wants to be in an ER. The wait times are long. Everybody's there all the time. You might get put in a hallway. It's loud. It's not like going in and scheduling time and making sure that you're seen privately. It's not one of those situations. It's chaotic. So when I say that, there's specific things that we always worry about with emergencies, like things like heart attacks, right? So I teach a course on like how to spot somebody having a stroke. What are some things that you need to be worried about if somebody's having a heart attack? How do you do CPR? How do you do like put an AED machine on somebody and shock them, back to life? All of those things are really important, but those are the really big things. I will say that people come for that stuff all the time. What I see that people don't come for is that, hey, I'm tired and I've been losing weight for like 6 months. And then they have to hear from me that they have cancer,
mm,
because it was something that they thought was just so minor. Oh, I'm working too hard. I need some more rest, or I'm just going to ignore this bump right here, or, it couldn't be me, or I haven't had this screening exam. So I always tell all my patients when I see them that if something is bothering you, that you're thinking about it for too long, it's better to be safe, than to say, I wish I would have come in early. So just come see me. Like, and if it's a stupid reason, I'll tell you this is dumb. I'm gonna still make sure you're good, but I'll tell you it's dumb, and then I'm gonna let you go home. But at least you have peace of mind.
Now,
yeah.
you just touched on something. You said there are some symptoms of something if somebody's having a heart attack or a stroke. So since we got you here, let's
Hmm.
talk about this. Let's talk about the signs. You didn't say symptoms, the signs of this someone's having a heart attack first, and then let's talk about the signs if this someone's having a stroke, so that our viewers can see, can just kind of get that in their system. So let's start with a heart attack.
Yeah, absolutely. So heart attack is one of those things that people like to think, oh, sharp chest pain is what's going to mean I'm having a heart attack. A lot of times it's just a heaviness sensation. People like to describe it as it feels like something's sitting on my chest and I can't quite get it off. If somebody is sweating and they're sweating for no reason and nobody else is sweating, that's a problem. And a lot of people don't realize that getting sweaty, getting nauseous, having heaviness to your chest, left sided jaw pain, or pain radiating up can be signs of having a heart attack. People think that it's going to be this big, sharp shooting chest pain and chest. It's really not. When people tell me, it hurts so hard, it feels like I'm getting stabbed, that's not a heart attack. When someone
Mhm.
is looking at me and they're like, I feel nauseous and I'm sweaty, that's a heart attack. Or I feel
Yeah.
like, oh, I've been throwing up and I don't know why, that's a heart attack. Or I'm having random left arm pain, that's a heart attack. So big things I would say is heaviness to the chest where it feels like you can't get it off, a little bit of difficulty breathing at with that. If there's any type of nausea or if there's sweating, those are things that should be concerned that you might be having a heart attack.
Now let's talk about strokes. Let's talk about that area. What are some things to look for in that area?
So strokes, there's like actually just exam stuff that you can do on somebody really quickly to see if they're having a stroke. One of the things is you can tell them to smile. My smile's a little crooked, so it's a little hard to show, but you can tell them to smile and see if there's a droop, and then ask them to raise their eyebrows. Now, if they can smile and like, so for example, if I smiled and there was a little droop on one side, but my eyebrows both go up the same, that's a stroke.
Mhm.
And other things is that asking them for slurred speech, if you're talking to them, ask them to repeat a couple of words after you, like, hey, Advocate Aurora, men's health community. If they sound slurred at all, that's a concern. Another thing you
Yeah.
can ask people to do is hold up their hands, just kind of like hold it out. And if one of their hands falls, that's a stroke. Those are the big
Mm.
things that people really need to be concerned about. So any type of facial droop, slurred speech, or weakness. Those are kind of the big ones that I tell people that if someone isn't acting right to you, just do those couple of things and try to figure out when was the last time that they were right. Because unfortunately with strokes, there's certain medications that we have to give within a time frame.
Hmm.
And what I find a lot of times with our black folks is that they're concerned about something, but they wait. So by the time they show up, they're out of that time frame. So we can't even offer them that medication. A lot of times we can't even offer them any other type of procedures or interventions because now this is just what it is. So all we can offer now is like physical therapy. How do we get you to find what your new normal is, you know?
Got you. Makes sense.
That's good information. Thank you for making us aware. Some signs to look for. Quick question for you about basically about ER visits. So how many ER visits in your opinion can be avoided just with preventative care?
A lot of ER visits could be avoided with preventative care. What I'll say is this: I unfortunately see people at their tail end of things where they haven't seen a doctor in years, right? So I'm
Right.
having to do preventative care in the ER, and I'm hoping that I'm catching them before it's too late, right? I'm hoping that, okay, even though I'm telling you you're a diabetic, I'm not saying that on top of you're diabetic, your heart isn't working anymore, you need surgery, you're having a stroke, you're having a heart attack. I'm hoping I'm not saying all of those things at the same time. So, in terms of preventative care, basic stuff like reducing the amount of strokes we actually see. If your blood pressure is controlled, you're less likely to have a brain bleed. I see a lot of young people. And when I say young, I mean like in their early 20s with
Wow.
high blood pressure. And you already know what that pathway leads to. It's that blood pressure, you don't feel it when it's high. So if you went to see a doctor and they checked you out and they said, your blood pressure is high. Let's do some medications or let's do some dietary changes. Let's control it. Most people don't do that. So when they show up, their blood pressure is like in the 200s, right? And now I'm telling them that there is no option. They definitely need medications. But I'm telling young people, right? And I'm saying young people like I'm not young, right? I'm telling young folks, like, your blood pressure is high. I know you don't feel it, but you got to take care of it. The next time I see them, it could be because they have a brain bleed. And I know that the pathway of high blood pressure leads not only to like strokes and heart attacks, but it also leads to being on dialysis. Nobody wants to be on dialysis in their 40s, but I'm seeing it because
Yeah.
so many of us have uncontrolled high blood pressure that by the time we show up, all of our other organs have gotten so used to looking at that pressure being so high and then they fail. And now it's not just, hey, it's the blood pressure only. It's, hey, it's all of these other problems for you. So just simple things like that, getting your blood pressure checked, getting your cholesterol checked, making sure that you're not a diabetic. Those big three are huge deals. And then for women, just making sure that your health is right when it comes to like gynecological things as well.
Yeah.
We often wait till we feel it. And when you feel it, it's often too late by that
Too
time,
late.
you know?
Mhm.
Mm.
Yeah, that makes sense. That makes total sense. Another question I have for you is, what percentage of visits would you say are mental health related as opposed to physical health?
I will say mental health is probably 25% of my day. And depending on the day, like if it's a weekend, it might be 50%, but there's a lot of mental health. We're fortunate at Advocate that we have something called a trauma recovery center to where we can refer a lot of people who there's reasons as to why they have their mental health issues, right? Different traumas that we've all faced. One of the things that I find with mental health, especially amongst us Black folk, is that there's either people who are very educated or people who are in super denial. There's no in between, unfortunately. And by the time they're saying me, my options are really, are you safe to yourself or to others? And if you're not, a lot of people don't realize that if a family member is a danger to themselves or to other people, legally, like we have to take control of that situation. We can't let them go back home. So a lot of people will come and they'll say, I'm really worried about my family member. They're not eating, they're not sleeping, they've made some statements. And then I turn around, I'm like, wait, if they've made those statements, I can't send them home. And it becomes this battle situation of where it's like, oh no, I just came to get them resources. I just came, but we're kind of too far gone. If
Mhm.
people present earlier and they're like, hey, I just need resources, we can set them up with a therapist, we can set them up with a psychiatrist, someone to, get them set and get them together to where they're not at this point. But unfortunately, yet again, you find that mental health starts so, so, so early, right? And we label it as like, oh, that kid is behaving badly, or oh, this and that is happening. And what's happening in other communities is that those behaviors have been labeled as, hey, these are possible warning signs, right? So they get appropriately evaluated. We never do. And by the time I'm seeing them, they're deep into their 20s and they are just in a mental health crisis. And now they're in the ER having to get the help that they should have been getting for years. Um, so it's definitely something that we're passionate about. It's definitely something that we can be doing a lot better about. And I think that one of the best things that I've seen is when, young rappers and young influencers talk to people about their mental health, like how many people felt the influence of when Gierber was talking about, having these thoughts and this process that reached such a mass audience of people that were like, you know what? I guess it's not okay for me to have been feeling this way for how many months, how many years. Maybe I should actually talk to somebody. And there is no weakness in therapists. I see a therapist because it's part of your health. Like mental health affects your physical. And a lot of
Right.
people don't realize that.
Yeah,
Makes sense.
absolutely. Yeah, so I got a question about fevers and temperature. So, what temperature from a fever should encourage you to go to the ER, and like what number is just like, okay, I got to get to the emergency room, and then what is a high fever in the body trying to tell us typically?
Okay. So technically, the definition of a fever is 100.4 Fahrenheit. But I want to see you at 101 because what happens is a lot of people show up and they're like, I got a fever. It's a 99. That's not real. And I'm going to just be real honest with you. When you tell an ER doctor, I got a fever, it's 99, I tend to run cold, that makes no sense. And we all laugh a little bit on the inside. We don't laugh outside, but just a little bit on the inside. And usually, what a fever is trying to tell you is that, there's some type of inflammation in your body. It might not necessarily be a bacterial infection. I want to talk about the differences with that, right? So, at any point in time, your body can go through inflammation. Our body's just set like that. If I bump my knee right now, that pain that I feel, it's an inflammatory response, right?
Hmm.
But if I have a cough, congestion, runny nose, I could have a bacterial infection where you need antibiotics, or I can have a viral infection where you don't need antibiotics. You just need to basically sleep it off, get a lot of water, get a lot of tea in you, and then you'll get better. And hopefully you don't get sicker from that. So people like to think that the number means something. The higher the number doesn't necessarily mean that you have a more serious infection. It just means that your body is like having a higher response to it. So I tell
Mm,
people whenever they have a fever of at least a 101 that they should come through and they should come see me. But they also have to tell me the other things they have. Like, do you have a cough? Do you have runny nose? Do you have diarrhea? Is your stomach hurting you? Do you have a rash? Have you had any neck pain? Because a fever by itself really doesn't mean anything to me. A fever with neck pain or a fever with headache, then we got a problem. So it's
Yeah.
always fever plus. So the
mm,
number doesn't matter to me. It's more so what's the other symptoms. And some people don't even get fevers and they're still sick. Like people who are on chemotherapy, for example, people who have lupus, their immune system is suppressed. So because it's lower, they're not going to get a fever. Surprisingly, our older parents that are 70s and above, they might not get fevers either because after a certain age, we actually don't necessarily get fevers when we're sick. But what they will do is they'll start behaving funny. All of a sudden, grandma's talking to herself, or, grandpa's seeing somebody that's passed on, or they're acting real mean. Most of the time, they have an infection somewhere and you can't tell because they don't have a fever.
Ah, that makes
mm.
sense. That makes sense. That's
Hmm.
that's good stuff right there.
Hmm.
Um, as an ER doctor, what are there any rumors you want to dispel about people of color being treated unfairly or unequally or not equal in like the ER? Is that a true thing or that's not true? What do you think as an ER doctor?
So I'm gonna answer it first as I'm gonna answer it as a black ER doctor because at the end of the day, that's who I am, right?
Right.
I think that in every single situation in this world and in this country that we live in, there are several times where people are treated unfairly because of the color of their skin. And I don't discount that from medicine and I don't discount that from the ER. People have their own biases that they bring to the table without realizing it all the time.
Right.
You would expect physicians to do better, to be better, right? Because they have such a gift of this wonderful job that we have, but not all of them do. I will say this is that in the ER, one thing I'm appreciative is that I feel like that's as close to equal treatment as everybody's going to get. which means that if unfortunately you were unlucky to interact with a cranky ER doctor, trust me, that person was cranky with everybody they saw that day, whether they were Black, Puerto Rican, whether it's just that that doctor is just a cranky person. It's
Hmm.
just a matter of fact that, people assume that, oh, you only saw me for like 5 to 10 minutes. You must be treating me poorly because of the color of my skin. No, I only saw you for 5 to 10 minutes because that's all I got for everybody. And it's not really about the color of your skin. It's about the fact that we're in an emergency department. Now, that being said, I do want to put people on high alert that it's really important that you advocate for yourself.
Hmm.
A lot of people feel like, oh, they get upset whenever doctors say things like, oh, you looked on Google. I want you to look on Google. I want you to Google all your symptoms so you can ask all the questions, because that's the time to ask it. Because one of the biggest questions that you need to be able to answer to your doctor is, this is what I'm concerned about. And your job is to tell me that I need to not be concerned about it. You know what I'm saying?
Hmm.
And I think that that's always the biggest problem in the ER, unfortunately, is that time is really fast. So a lot of people think that, oh, I'm getting poor treatment because of this. It's just the nature of what the ER is like. Lots of ER doctors low key have like ADHD. So it's just a matter of that everything is going all at the same time. And people
Hmm.
do sometimes have to prioritize people's complaints. Like, I'm not going to spend all day with somebody with a belly pain who has normal workup when I got somebody who was just a victim of a gunshot wound coming in.
Right.
That's just not my priority. I got to make sure that I take care of the person who's sicker first, and I'm gonna get right back to you. Um, but I'm still gonna get back to you, and I want you to tell me what you're concerned about.
Got you. That makes
Yeah.
sense.
Now,
Okay.
the question that I have for you is, a lot of us kind of sometimes feel like we can be superheroes. And so, in the case of an emergency, when is it wise to call for an ambulance versus trying to get yourself there and feeling like you can get yourself there and save some money? If we be real, we like, you know what? That's just
Right.
an extra bill. So let me go ahead and drive myself. So can you give us some wisdom on that?
Yeah, absolutely. I think that if you are somebody who has a lot of medical problems, you should call an ambulance. One of the reasons is that we have wonderful EMTs and EMS who basically they're equipped to basically handle if you were to start to decompensate, start to go down really fast, where you can't do that in your car. So if you're a young, healthy someone without any medical problems and you're coming in because, hey, I'm feeling a little sick, I got a little fever, something else going on, you can drive yourself. But if you are nauseous, like you got to throw up, if you are dizzy, if you have passed out, if you're having any type of chest pain, if you're having any type of shortness of breath, you need to be calling an ambulance, because those are the big things that can go bad really quickly and you might not realize it. It's just like if it's an older person, I would rather an older person call an ambulance any day. If a person has a seizure history or a lot of medical problems, I would rather them call an ambulance. And I'm not saying, hey, I have controlled blood pressure, so I should call an ambulance. That's what I'm saying. I'm saying that if you're someone who has been in and out of the hospital and you know your health status is one that is poor, you're better off calling an ambulance. I would much rather you call than stay at home and then try to drive and then go through the waiting room. Because what a
Right.
lot of people don't realize is that people call the ambulance, and some people, I will say, do abuse calling the ambulance, right? They think that it's going to get them jump to the front of the line. What a lot of hospitals are doing now, especially since COVID and how many people that we're seeing regularly, is that people are saying, you know what? I'm gonna call an ambulance, and then they get assessed and seen by somebody really quickly. And it's either you go straight back to a room or you go down to the waiting room. So you want the opportunity to be able to be taken straight back to a room, especially if you're really sick.
Right. Now, what are some of the most common reasons you see black and brown people in the ER besides gunshot wounds? Now, if you say that, that's obviously, but besides that, like health, like somebody shoot you, of course, but health wise, what are some of the most common reasons you see black and brown people?
I will say it kind of varies with age. So I would say, like, younger people, I see them a lot for things just like a basic. I've been having a headache for a really long time, and it
Hmm.
turns out that what they've been having is high blood pressure,
Okay.
or they have new onset diabetes. That's what I would say that I see a lot of black and brown people for. It's not ever like, oh, my stomach hurts or anything like that. It's never, and a lot of mental health, unfortunately. is also another big area that I see a lot of Black and brown people for. When we start to swing into being a little bit older now, we now have people who have diagnosis of things like, hey, I'm on dialysis. So now it's now the complications of all of those things that happened when we were younger. It's now I'm coming in because my diabetes is out of control. So I need you to do something about my diabetes. Or I'm coming in because at dialysis, something went wrong. And now I need you to take care of me because of those reasons. So take everything that would have been better controlled with a primary care doctor very early that we first diagnosed in the ER. Because when you get a diagnosis from me of high blood pressure, I'm sending you up with a primary care doctor. I'm sending you home with 30 days of medications. And my expectation is that you'll follow up with the primary care doctor. You'll pick up those medications and you continue to do those things because
Right.
at the end of the day, I can't care more about your health than you care about your own health, right?
That's a
That's
fact.
my hope, right? But I'm not a primary, so I'm not going to follow up with you. I'm not going to call you at home and say, how's those medications treating you? I'm not going to do that. I work in the ER. So the next time, I'm hoping that I don't see you next time, right? But the
Yeah.
next time I do see you, now it's a complication because of those things, and
Exactly.
now we now have to deal with what is going to be your new normal. One thing I really, really, really want to tell a lot of young Black men about is just protecting yourself, period. Like protecting your mental health, protecting your physical health, protecting your sexual health, because that's another thing that we see a lot of young Black people, especially Black men, in for. It's like, hey, I want to get tested for this. And then it's like, you got to follow true on the treatments also. It
Hmm.
can't be that we're coming back and forth to get treated for the same thing over and over and over again. You know, so I would say that it's not always like one big complaint, but it's always things that show you that there's a knowledge deficit when it comes to health literacy, right? There's not a lot of talks about educating yourself about what your healthcare status is. And in addition to that, poor access, right?
Hmm.
So we don't have access to get the care that we need to get primary care stuff. So you got to get your primary care in the ER.
Yeah.
Got you.
Gotcha.
That's huge. That's huge.
Yeah.
Mm-hmm.
And so another question I have for you is like my brother here, he just had a newborn. I have four children. He has one.
Congrats.
Thank you.
And
Hmm.
just as a new parent, just kind of wondering, when is it wise for us to take our children that can't speak for themselves to let us know what's going on with them to the emergency versus kind of treating them at home and waiting for things to kind of shift and get better.
Yeah. So this is also a really big thing about ages because children go through stages of when they are more likely to be sick than others. Like with the newborn, I would say anything with your newborn, you need to be coming in. Your newborn looks a little yellow. You got to worry about how's the milk that they're taking in settling. Your newborn has a fever, especially under 45 days. We take that very, very, very seriously because at that point in time, they don't really have an immune system, so they can't really protect themselves except from whatever they get from breastfeeding, right? So everybody else around them has to protect them. And any young, I want to say less than 29 days, we usually have to work them up for meningitis because if a child has meningitis, which is an infection of the brain, they're never going to be right, if they're not treated appropriately. So I say up until the first 2 years, I'm super hyper vigilant. Like anything happens with that child, if the child falls, the child bumps into something, the child has a fever, the child has a rash, go to the ER if you can't get in to see your pediatrician. First step should be call your pediatrician and ask, hey, is this something I need to go to the ER for? And most pediatricians are actually good about keeping long hours. So they might see you and then say, yeah, you got to go to the ER. Or they might see you and say, no, it's cool. It's just an ear infection. We'll take care of it moving on. Now, as kids start to get older into that toddler age, one of the big things that you have to worry about is that they're really active, so they break a lot of bones. Um, and this is where I would say that you see your kid limping, you see any type of bruise, you got to take your kid in to be seen. But this is a really important place to advocate for yourself as a Black parent.
Mhm.
Is that you need to make sure that when you're taking your kid in, you're telling them exactly what happened and that you're also vigilant of how people are responding to you. Because unfortunately, Black people are more likely to get like child protective services called on them for basic, regular, everyday injuries that kids have all the time
Wow.
that have like no actual premise, but it's just, whatever
Hmm.
somebody's personal suspicion is. And
Yeah.
because medical providers are mandatory reporters, all they have to do is say, hey, I'm concerned. And then all of a sudden there's an investigation started. which
Hmm.
can be appropriate in certain times, but it's still important that you advocate for yourself and your child in that situation. As we get into teenage years, we really got to talk about mental health because
Hmm.
unfortunately we have a lot of children that mental health isn't something that's talked about. If you talk about your feelings, then you're a punk, then you're this, then you're that, and that stuff follows you for the rest of your life. One of the conversations I had with my now teenage sister is that I need you to tell me every and anything that's wrong with you, and I don't care if you think that our parents don't need to know about it, right? Because I need to know, because if there's something that I can do about it to get you the help that you need before you're unfortunately now in a system and you're labeled as somebody that is like someone who
Hmm.
has mental health problems,
Hmm.
which can be a situation that follows you for the rest of your life, without
Yeah.
realizing it, right? It's really important that you start having those conversations with your children, and not just mental health conversations. As teenagers, you also have to have conversations with them about their sexual health and how to say no in situations that they might be feeling pressured to do so, because unfortunately that's also a big age group where we see a lot of sexual victimization, right? And then they end up having these traumas that follow them for the rest of their lives, which can also then develop into mental health disorders as well as physical disorders. um,
Yes.
so that's kind of like the grouping that I would say. Babies, you got to bring them in for everything. Toddlers, it's going to be musculoskeletal stuff like they've broken bones, they've hurt themselves, they're limping. And then teenagers, we got to be hyper aware of like the social aspect of medicine.
Mhm.
That makes sense. That's perfect, man. Well, you listen, Doctor O. We could talk to you all night long, like Lionel Richie, but we know you got things to do, people to see, and dogs to tame. So we just want to
Yes.
say, we just want to say thank you so much for your time. This time went so fast. I had 18 more questions, but I ain't gonna do it to you this time. We're gonna bring you back and make sure we get the rest of those questions in the next time. We really thank you so much for coming and dropping
Absolutely.
so many gems on us, giving us the signs to look for heart attack and stroke, and things of that nature. So we just want to say thank you so much for your time.
Oh yeah, for sure. My pastor used to say something. He said, "Strong but not long." I'm like, you gave us so much content in
Yeah,
this short period that we're truly
right.
grateful. So thank you. Until we speak to you again, again, thank you for your time and your knowledge and everything that you're doing to impact our community. We appreciate you.
Absolutely. Thank you so much for having me. I love this. I love us. And I just want us to win in every single spectrum and aspect of life. So thank you.
Oh, you're
Thank
welcome.
you.
So, listen, everybody out there, we want to encourage you to take control of your health, and for the families, teach your boys and young ladies healthy habits throughout their childhood. Chad and I are truly grateful that you guys tuned in and gave us your time and attention, and hopefully something that was said from Dr. Okubanjo or one of the fellas was going to impact your life and just have a great experience impact on everything that you're doing in a positive way. So, till next time, we love you guys, and we'll talk to you soon.